and wish you well in the work that's going to be before you. We have put together a panel for this call to talk with recent fellows and discuss with them some of their explorations and some of the work that they encountered while they were in their fellowship role. They've now moved into their new positions, and so have a lot of lessons learned that they would like to share. As many of you probably know, the National Council on Administrative Fellowships was created, though, to create a better structure for administrative fellowships, both offerings as well as uniform application dates and offer dates. So many of you may have been the first to encounter the work that we've been trying to do. It's been something that has been of interest to NCHL as well as to the field for many years. And this is really very much a pioneering effort to really start the coordination of what is a very essential part of early career opportunities within the profession of health management. So a few years back, or last year, I guess, we started these quarterly webinars for NCAF fellows as a way to provide some educational opportunity across all the fellows and to share some new learnings and so on. So what will happen going forward is we are very much interested in hearing from you regarding what other topics you might be interested in. If there's something on your plate that you would like to either discuss or bring in a leader from your organization to do a webinar, we'd love to hear that. This is very much a forum for fellows to be able to learn and to share. Our goal is for this year is to also do a face-to-face meeting of fellows in March in conjunction with the American College of Healthcare Executives Congress. And so we did one this past year. We hope to do another one this year. So you'll also be hearing back from us regarding that. So with that, I would like to introduce our 4 fellows today. We have Cory Dominic from Franciscan Missionaries of Our Lady Health System down in Baton Rouge. We have Cavani, who goes by Rouge at the University of Chicago Medicine here in Chicago. We have Emily Levin, who is with Ann and Robert H. Lurie Children's Hospital of Chicago as well. And we have Tyler Rood, who is with St. Joseph's Health out of Napa Valley, California. So with that, I would like to turn it over to Cory to tell us a little bit about his experience, and then we'll just move down the line, and then we'll open it up for questions and answers. Thank you so much. Go ahead, Cory.
All right, thank you so much. Thanks for the introduction. My name is Cory Dominic. I just completed my fellowship in April, middle of April of 2016. So it turned out to be a 1-year fellowship, but I ended up finishing about a month and a half early to get started in my new position. And right now I'm with Franciscan Missionaries of Our Lady Health System, which is the, I guess, parent company or corporate headquarters of where I did my fellowship with Our Lady of the Lake Regional Medical Center and Our Lady of the Lake Physician Group. So I kind of thought that this was going to be addressed more towards those who are applying the fellowships or second-year grad students, but I think it'll definitely be applicable to current fellows as well. To even be like cliche a little bit, going about the most valuable experience out of a fellowship, I personally think that it's the fellowship itself. Coming straight out of grad school, having only worked, full-time 3 months in my entire life, and that was during, the summer of my 2 years of grad school, and come into a fellowship and into like a leadership position. There's not a better opportunity out there that, can project your career, especially if you want to be in healthcare. So kudos to everybody who's in their fellowship and wishing to apply. Going on to about the first month of the fellowship, one of the topics I was asked to cover was orientation or onboarding, what worked well, and what I think other fellows should try to repeat. So traditionally went through the normal one-on-one orientation day one. And then we had a lunch with all of our senior leaders to kind of get to know each other. And throughout the whole orientation, or at least the first month, you'd call it a grace period, at least in our organization, where we just were challenged to get into the organization, go to as many meetings as possible so that we can figure out what the heartbeat is driving our organization, figure out what the current, projects and, initiatives are going on. So a lot of the first month, we weren't even involved in projects yet until about a month and a half or so is whenever they started getting piled on quickly, if you can imagine. But throughout that first month too, and they don't ever fail to mention this in grad school, you got to network. Networking is the most important thing. We had set up one-on-one meetings with all of our, senior leadership, even our CEO, or we're lucky to have a CEO in our health system that was a previous fellow, so he knows exactly what we were going through. And his advice to everybody was just, have fun. You have 1 year to do this, learn as much as you can, and enjoy it. So coming from that, it's a great start. And through those one-on-one meetings, with all the senior leaders, directors, what have you, it helps build a relationship, because one of the first things as a fellow, you're in this huge hospital, you don't even know how to get to the meeting room. So it's helpful to put a face to a name, and then also get some mentorship along the way. So if you can imagine, when the projects start rolling in, if you didn't have that type of networking or one-on-one meetings, you don't even know who you need involved in your project. So, one of the first projects I was put on was to consolidate 2 clinics and then build out an imaging center and lab. And so they wanted a financial analysis of what that would take. So if you think about that, we need somebody involved from our physician group, somebody involved from, our radiology department, facilities planning, our lab as well. So if I'm coming in day one, project sitting at my desk, I'm going to sit there spinning my wheels. So if there's an opportunity out there for you to get these one-on-one meetings, whether it be 30 minutes or an hour, that's something I would definitely have you, or encourage you to take advantage of. One of the other things, I've kind of got a free ball topic, what other experience that I wish to go into detail about, and I wanted to go into detail about the difference between a rotational based fellowship and a project based fellowship. And I can't really speak too much on the rotational based, because ours here at the lake is strictly project driven. So there's 2 different paths that I think you have to think about, whether you're going to a fellowship or whether you're in it now. So in our project driven, the one I went through, you have the option to do rotations. I took it as a challenge. Coming out of graduate school, I have all the theories, concepts, and all these financial ratios, but I didn't know how the whole system worked together as a whole. So in my mind, I looked at our delivery system as a huge puzzle, all the different puzzle pieces being departments within the hospital and outside. And by my end of the year, it's my challenge to put them all together and see how they work together to, deliver healthcare and, be who they are in the community. So with that said, in the more rotational based fellowships, I think there's more of a path to get you there. I think there's a curriculum. You're going to go through finance, you're going to spend time in operations, you're going to get it all. Within our project-based fellowships, it's really truly on yourself. And they give you the map, it's open access, and being in an organization where it's been fellow rich history, everybody knows who you are, so nobody minds you coming in and sitting in on a meeting or visiting the department and learning. The best example I can give of that is I like comparing the project-based fellowship, or how it should be, comparing it to Disney World. So we have 1 year, it's like an annual pass or passport at Disney World. You got the passport, they give you a map, and they say, if you want to ride Space Mountain, ride Space Mountain. Comparing that to the hospital, if you want to go spend time in supply chain, radiology or with the physician group, you go do that. Of course, you're going to have, your core projects you're going to work on, but there's always should be time as a fellow for you to do rotations throughout the entire year or 2 years, whichever it may be, because that's the point of the fellowship. It's for you to learn, to be mentored, and also work on projects. If you weren't doing a fellowship, you'd be in a normal job and you'd be in one department and learning that. The fellowship gives you that opportunity and should have the access to go and learn about anything in the hospital that you wish. So I'll kind of leave it there and definitely take questions at the end. Pass it on to Roche.
Thank you very much, Cory. And next, we will be hearing from Lucius.
Hi, everyone. My name is Cavani. I went to Columbia University for my master's in public health and healthcare management. And as you can probably see, I did my fellowship at the University of Chicago Medicine here in Chicago, where we have a 2-year fellowship. So Cory explained a little bit about the difference between a 1-year or 2-year and project-based versus rotation-based. At U Chicago, we're a hybrid fellowship. So your first year is rotational. Your second year, you actually choose an area to go into, and you either have an interim role or you kind of are working for a director or vice president of that particular area. And the first year, even although you're rotating through each of the different operational and administrative areas of the hospital, you're still actually having quite a bit of opportunity to work on projects, both at a high level and some more that could be done within your rotations over the course of a few weeks. So it's very unique, something that's not for everyone, definitely, but I think in a way really gives you a year to still learn a lot about a health system if you haven't worked previously in hospitals that often, and also gives you the opportunity to then master some more of the management skills and project management skills during that first and second year. So in regards to speaking about our most valuable experience from my fellowship, I think, again, I'll echo what Cory said. It's having that ability to really do anything you really want. Although there's structure in the rotations and their deliverables, you have kind of unfettered access, at least at University of Chicago, to the leadership team, to any department you really wanted to learn more about. So if you did a rotation in, let's say, business development and strategy, and you really enjoyed the work there and you picked up a project there, you always had an opportunity to get plugged into some key meetings from that area, something you really wouldn't be able to do in a career or in a position if you came right out of graduate school. So I think I took that definitely for granted, and something I've been learning to wean off of now that I'm in an official role at the institution. And the other big thing I would say that was the most valuable is the visibility that the fellowship provides. And I think this is probably around any health system. Fellows are generally, even if it's project-based, have a lot of access to C-suite or senior leadership within the hospital. The work that you produce, the exposure you're getting is at a very high level. And with that, it can be good or bad depending on how you perform. But for the most part, if you're working hard and challenging yourself, they're going to want to keep you on, and it'll set you up for success within the institution. I think for me, it's a testament to having led to the position that I ended up actually accepting at the institution. So I'm happy to talk more about our fellowship offline, but I'm going to move on with the 2 questions that I'll be speaking about. So one was on advice on asking for feedback. I think this is often one of the most uncomfortable things to do, both as the person who wants the feedback and sometimes for the person that's providing feedback. And all I can say is you really have to get in the routine, and this is what I did, depending on who your mentor is, whether it's someone that's more at the executive level in the fellowship or more of a peer mentor or someone mid-level in their career, you really want to get feedback from all levels because they're going to give you different insights. So some might have a better sense of your actual skill set and what you're working on for that particular project and be able to give you direct feedback related to that. I think the best way to bring these up is at one-on-one meetings that you have with them. You can be even as specific as asking for feedback on a particular forum. So what we did here at University of Chicago is with each of the project leaders and each of the rotational owners, we give them a a form with about 20 fields on there that they can rank the fellow on and provide comments. You could be that structured, but I think oftentimes it's as easy as just hitting someone up for, hey, can we get a coffee? Like, I would love to hear from you, what you think I could work on. What do you think that I've done well, so that you know what your strengths are. I think it's hard to find someone that's going to be honest, so just gauge that with the relationships you develop. And don't be afraid to go outside of the formal mentorship structure that you have within your fellowship. A lot of people that I seek are people that might hear about the work I'm doing indirectly. Oftentimes that could be past fellows in the institution. I know at U Chicago, there's definitely a strong fellowship network, even though we're a newer fellowship. The past fellows have great advice for current fellows. They're happy to give you feedback, and they often hear through the grapevine how you're doing. So I can't echo that enough or preach that enough, to really seek feedback at all levels. You won't know what you're doing poorly unless you ask, and there's nothing wrong with getting constructive feedback, particularly during a fellowship, because it's still a time to learn and to grow yourself as a young leader. And then in regards to the second point, so what's the most important learning outside of graduate school that I think prepares you for not only the fellowship or being in a fellowship, but in general after the fellowship when you are moving along in your career, is to really make sure that you have an open mind, that you're flexible in the sense that your interpersonal skills, the way that you interact with clinical staff, with physicians, nurses, this is not something that's taught to you necessarily in an MHA or MPH program. You're working with a bunch of other colleagues that are going down the same track as you. And in the real world, you're often going to be working with various other backgrounds. So whether it's clinical backgrounds, maybe frontline staff that may not be as highly educated. And so how do you temper the conversation? How do you engage the different stakeholders to make sure that you can effectively drive forward your agenda or your project? And I think the way you do that is by putting yourself out there with the projects that you take on or the exposure that you're getting, making sure you get early exposure to working with physicians and understanding where they're coming from. And the same with frontline, going into their shoes. Many times you hear about people that take on management level roles after their fellowship, or even project manager roles where you're a bit removed. Going into the shoes of those that are doing the day-to-day work and understanding where they're coming from, I think is very important, and will set you up to be a stronger leader if you understand their perspectives. The other thing I would say is you'll never really know all the answers. It doesn't matter how smart you are or what you're able to do. It's a team sport. So being in healthcare administration, one thing that I've learned being at an academic medical center particularly is you have to lean on your team. And if you don't even have a direct team, lean on your colleagues in the institution for things that you may not know. And it's okay to say you don't know and to follow up and with the appropriate people that can help you and to learn from them. I think it's often there's this feeling in a fellowship, well, I should maybe know this, or I should try to figure it out on my own. And that's definitely appropriate for many scenarios. But I think at the same time, to be humble enough to know that it's okay to ask for help. And again, it may not be something that's clearly taught in school, but as you're developing as a professional, I think it's actually sheds more on you as a leader when you are able to reach out to others. So I know that's a brief overview of my fellowship and my background. I'm happy to answer questions at the end, and of course, feel free to email me whenever if you have any questions.
Thank you, Lucian. And then at this time, we're going to turn it over to Emily Levin.
Good afternoon, everyone. My name is Emily Levin. I graduated from the University of Minnesota's Bachelor's of Healthcare Administration program in 2015. And recently finished up my administrative fellowship at Ann and Robert H. Lurie Children's Hospital of Chicago, a bit lengthy name there. So I did that in July and have since then transitioned into a practice management role for the Division of Pediatric Surgery. So that's, you can think of that as more like general surgery. So I've been in this role since mid-July. During my administrative fellowship, which is a one-year project-based program, you have the opportunity to really kind of drive your experience, which is, I'll probably echo a lot of what Cory and Ruth had mentioned before me, but it was a great opportunity to kind of figure out where you wanted to land after your fellowship. I think that's one of the key differences between rotation-based and project-based fellowships, at least from my perspective. I wasn't really sure where my interests were, so I wanted to have the flexibility to move about an organization as well as a system. So that's something that Lurie Children's definitely supports you and allows you to do. One of the great things about this program too is immediately when you come into the organization, you meet with all of the senior level leaders of the organization. So you are set up on one-on-one meetings to meet with all the people that you will be interacting with in some way or another within the year, your year in the fellowship. So that starts to build your network quite frankly on day one. So that was really helpful, and I think that opens doors throughout your year in the event that you're on a project and don't know, you're not as familiar with, you already have this core network to really support you. I think that's one of the most valuable experiences that I've taken away from my fellowship is just that relationship building and networking. Also, as a project-based, where you're everywhere from frontline to high-level strategy projects, you really gain a wide range of institutional knowledge. I like to think at any point in time, the fellow really is one of the most in-the-know people in the organization, because you know everything from what's going on from frontline staff again up to the boardroom, and that's really powerful. It allows you to be able to communicate and to really kind of have a fluid relationship throughout the organization, and you definitely know a lot about what's going on. That has translated into my current role as well, really learning how to navigate Lurie Children from resource identification and connecting different people and different parties across the system, as well as just understanding how things are approved and who is influenced. So I think having that, having the ability to see key leaders and sit at the boardroom and be in those high-level conversations is incredibly helpful. Even in my current role, which I like to think the administrative fellow really has kind of this golden ticket where, you're at a master's level, so you're very bright, very intelligent individual coming in, but you're still learning. So you have kind of this free card. I like the Disney reference that Cory had mentioned earlier, to really kind of make it your own and to really be able to see some really cool things and learn a lot. So I think that's important to keep in mind. So to move on into kind of my key questions that I would ask to speak to. So my advice for any new fellow initially is to start to think about, if you haven't done so already, for those who are in a fellowship or moving into a fellowship, I would advise to set goals, whether it's professional development or certain skills that you would like to build over the year. Because once you get started, at least at Lurie Children's, people are eager for your help. So before you hit the ground running, really take time to focus on what you want out of the fellowship and to have 360 evaluations with your mentor on, are you hitting those tasks, and to make sure that you are getting everything out of it that you wanted. I think it's also valuable. I utilize, it's the National Center for Healthcare Leadership Core Competency Tool, and I was able to link all my projects back to what it is that is best practice for developing into healthcare leadership. And I thought that was a great way to think about my project. So again, if you're thinking of how to concretely kind of put pen to paper on what you did over the year, I think those are kind of two important tools to link back to. I echo again what Cory and Ruth said about mentorship and building relationships. That really is, you have an open door. People open the door for you. It's your chance to walk through it. So that's important. People, as Ruth said, the teamwork is key in healthcare, particularly for someone who's very new to the organization and new to just this career as well. So that's something I would stress as well. And the other thing I would say is be open to feeling uncomfortable. So I myself have a science background, so the financial piece really wasn't my strong skill set. So it was important for me to seek out those opportunities and to become more comfortable. So as odd as that sounds, be comfortable with feeling uncomfortable, because that's kind of the gear, but it's all in the nature of the work, and it'll fare out well at the end. In terms of just projects and good project rotation, so I can't really speak to rotations as much, again, because Lurie Children's is project-based. But what I can say is what I think is a good project, again, just general definition, is a project that allows the fellow to lead multidisciplinary individuals to really accomplish an outcome within a time frame of the fellowship, and that adds notable value to the organization. So I had the opportunity to work on a couple of strategy projects over my fellowship time period, which was great, but it's also, if those don't play out or close by the end of your fellowship, you also want to make sure that you owned something, you led a team, you managed a process. I think to be able to speak to active participation is really important to come away with. I don't think you necessarily have to have, 50 projects for really concrete projects that you definitively, and you can speak easily to the value you've added or process you changed, again, or a team you've led is really powerful as well. My advice would be to not always judge a book by its cover, to take the cliche. I'll give the example. I was asked to do what I thought was just a research project. And it turned out that the research that I provided, I was able to present to our governance board multiple times, as well as help drive the next 10-year strategy for the organization. So I think it's important to, again, be uncomfortable with feeling uncomfortable, as well as just be open to opportunities. If you're here to learn, go into it thinking as best as possible that this is, it's a great learning opportunity. But I think as far as projects that span everything from frontline to high-level strategy is important, but to keep it balanced. So have strategy, operations, project management, and then to work on refining those key skills that you really want to walk away with. That was kind of a lot. Happy to answer any questions at the end. Also happy to chat with anyone who's interested in Lurie Children's. But I'll sign off and hand it over to Taylor.
Thank you, Emily. Our final presenter is Taylor Rudd. Welcome, Taylor.
Great, thank you, and I am happy to be here. My name is Taylor Rudd. I was a graduate of the University of Alabama at Birmingham with my MSHA MBA degree. I have done several internships during the process, whether that was in undergraduate and graduate school, and then I was the fellow at St. Joseph Health, Queen of the Valley Medical Center in Napa, California. It's been a fantastic experience so far. They've asked us to share, one of our favorite experiences, and my most favorite experiences was a project I was involved in with productivity, and I'm sure a lot of you know what productivity means. And it wasn't necessarily that the project was the most difficult or time-consuming to get through. It was the fact that it gave me the ability to sit down with so many people, managers, directors, everybody, and explain and help them understand the process of productivity, and really establish myself as someone who understood the process as well as all the systems that were involved in that. And so that kind of ties into the topics that I was going to talk about. First was taking on leadership roles inside the organization as well as outside the organization, as well as looking into your next position. So first off, taking on leadership roles. And it could be different from different fellowships that you're involved in your organization, but here I feel definitely the fellowship position is viewed as a leadership role. You come in highly trained from different programs. You have a lot of leadership training, more so than a lot of the people at the organization. You may not have as much experience, but you have training, and you can utilize that training and get that experience quickly. So, what's the first thing you do when you come into an organization? You're a new fellow, you feel like you want to be a leader, you want to be that person. Well, in order to be a leader, you have to know the people that you're working with. So you got to get to know everybody. That means not only the executive staff, everybody on the executive team is going to know you. It's kind of their project is to bring in the fellow and to train them. So not focus so much attention on getting to know them, because you'll have that time, but going out and meeting with the different nursing directors, meeting with the director for your EVS staff. What do the dietary people look like, and who are they, and who's their leaders? All the different supervisors and managers and charge nurses, all of those people you are going to want to know, because they are going to be crucial in getting data that you need, getting participation that you need when you're working on different projects. Those are the people that get you the information that you want to know and need to know. And having a good relationship with them is crucial to your success. So going back to my productivity turnaround at our hospital, we were running at about 93% productivity, which, if you are aware, anything below 97%, you're starting to get a little worried. And so we were down there a ways, and so it was my job to go and instruct them how to use the tools, how to use the systems to help them improve their productivity. And that leads into my next bit of advice is to every hospital uses different systems, different tools. Here we use different systems to manage our financial records, and a different system to manage our productivity. We use a product called Workforce Analytics. We use different Chronos tools. All of those things, I would say that one of the biggest factors of success that I had here was the fact that I got to know all of those systems very well, so that if anybody ever had any question of why this worked this way, or I don't understand how to look this up, I can answer it on the spot and did not have to go to anybody else to get that. So wherever you're at, make sure you you understand the tools, you know how to look up the information, you know how to look up the data. That way you become this wealth of knowledge for people. And they'll start coming to you with questions and things that they need, and you kind of start to establish yourself as a leader there. One of the bigger projects that definitely helped with leadership that I was involved in was we had an outpatient infusion center for chemotherapy patients that was close to the hospital, but it was a physician-owned practice, and they did that, and the hospital wanted to acquire them, bring them in, and turn it into a hospital outpatient department, which was done. And the amount of systems that had to be correlated, there was, they used different systems for their record keeping and their scheduling, which didn't necessarily work so well with the way our schedulers worked here at the hospital. There was the oncologist and the nurse practitioners, and making sure that their practices were in line with how we did things over here. There was so much to do, and the fact that I had all those tools in my hands and was able to look up data for them, organize different teams to come together, was crucial in establishing that I wanted to be a leader in this organization. A couple other things, making yourself a leader. It's important to be professional. It's important to understand the business. It's important to get all those things. But I feel it's also very important to be a fun person. You have a lot of meetings, and there's a lot of serious stuff going on, and it's important to be that. But it's also important that people enjoy when you come to a meeting. When you are there, and people like it when you're there. They like to talk to you, not just about work, but just because you're a fun person to be around. It gives you a little more credibility in your opinions and your thoughts when people like the fact that you're around. And then lastly, just speak up, have an opinion. Even if they disagree, they may disagree with what you have to say. They notice that you are talking, that you are have an opinion, and you have knowledge about these situations. So going into the next question, looking forward to your next position. There was a question I just saw in here, when and how did your conversations about your post-fellowship role come during your fellowship? And that's actually one thing I wanted to talk about, so I'll kind of go into that as well. First of all, when you're thinking about your next position, thinking about your career, you need to understand what you want to do. I know in my graduate program, there were several people at the beginning of their fellowship that didn't understand what exactly they wanted to be. And I'm not saying that you have to decide, you know, I want to be the CEO, I want to do this, I want to manage, you know, practices, whatever it is. But you need to have a pretty clear idea of where you want to go. Executive teams like to know that you have a direction, that you have goals, and so that you can clearly articulate that to them. After that, excuse me, I was very clear, probably 6 to 8 months in to my fellowship, I was clear that I was strongly considering and would love to be considered as a permanent candidate here after the fellowship was over, and that you know, I'm working and to meet those expectations of what that would be. Made sure that I was getting clear feedback from my direct preceptors of things I could do better. I was improving on things, and as I started those conversations early, they started to happen. I was fortunate in the fact that other sister hospitals in the system that I was in was starting to contact me about possible positions, which made it a little easier to discuss different opportunities, as I would bring up that, you know, this opportunity has come up and I'm thinking about it. Do you think there's something we could do here, because I like where I'm at? Just be honest in your discussions with your preceptor. If you've worked on your relationship with that person, it shouldn't be a difficult thing to talk about. If you're doing a good job, you're getting things done, and you know, and you will be able to tell whether or not you do that, you know. It's not a hard conversation to have. So I think the question and answer part of this is going to be probably the most beneficial. So I'll just kind of cut it off from there and leave it to the Q&A session.
Thank you, Taylor. So as you said, we will be starting our Q&A session. We have a couple questions that were sent in before the webinar began that I would like to start with. And the first one would be asking the panelists if you were able to complete the projects that were assigned to you, or did you help out and move on to the next project?
I'll start with that, and this is Cory Dominic. I would say many of the projects we work on are, some are short-term, some are long-term. One that I was involved with is our organization is doing a full-blown Epic implementation March of 2017, and you know, the preparations for that are so longitudinal. They're going back to 2015, maybe even 14. So I was brought in on one of those projects and helping out with one of the applications and the project management of that. And it's almost just the, you know, the traditional way. That project, as I moved on to my new role in payer relations, it just kind of got, you know, handed off to the new fellow coming in, because that's, you know, it's a great, another great project for them to come in and work on. So you're not falling short if you don't finish all your projects. You got to understand that, you know, many of them are, you know, the scope is so large that it takes time. But most definitely those ones where you do have, you know, deadlines and whatnot, you should, you know, definitely come to completion on those.
This is Emily. Oh,
go ahead.
Oh, sorry about that. I was just going to add on. I think, so at Lurie Children's as well, there were a couple of projects that I knew I wasn't going to finish by the July end date that I had signed off on. So I think being able to communicate and prepare a communication plan and a transition plan with those key stakeholders, as well as whoever will be taking your place, is really important, and actually a great skill to build as well. So I think just being honest in the timeline, as well as the time frame that you have signed up to be the fellow, as well as your transition plan, is important. And I think my mentors were key in driving that communication.
Thank you, Emily. Would anyone else like to touch on that question? All right, well, moving on. Another question that we had is regarding conflict. So did any of the panelists have any conflict come up during their fellowship, and how was it resolved?
This is Ruch. Oh, go ahead.
Oh, no, sorry, Ruch, you can go ahead. I'll go after.
Okay. Yeah, so that's a good question. It's a tough question. I'm trying to think of an example. I don't know if it'll be good enough. There was definitely in my situation where there was conflict within the team that I was working with, not necessarily with me and someone else. So to give like a high level overview, essentially we were working on or trying to streamline our head and neck cancer program. So it's probably one of our most prominent programs, but in terms of operations, we have many issues starting at the call center all the way through to the patient getting in our door. And so it's been escalated as high up, for instance, to the dean. So a lot of the physicians, given the profile of the program, bypass all standard chain of command with the clinic managers and just go straight to the president and the dean. And so I can speak to a little bit how you diffuse situations like that, and you may encounter a lot of situations like this and this type of indirect conflict, and it's by constantly communicating with each of these stakeholders. So one thing that didn't happen in this case, they weren't regularly apprised of the work that was being done behind the scene. And for them, they figured the only way that they're going to get a response immediately is if they escalate up. So same with setting that expectation. And then, of course, not just via email, because today it's really easy to try to, resolve these things via email. The worst thing you can do in terms of conflict or anything is to let things escalate over email. And that may sound like something that's very obvious, but oftentimes it's not. Set up a person in meeting or set up an in-person meeting, get the people in the room, talk it out, make sure you have other people there that can support both sides, understand where people are coming from, but don't ever let it escalate via email or any other forum that isn't in person. I hope that's somewhat helpful.
That's a great answer. Emily, would you like to also speak to that?
Yeah. So I think the fellowship one is it's just an interesting position. So you don't have any direct reports, and you have a mentor or multiple mentors who are your bosses, but you also, at least for me, people have access to you from all over the organization. So what I think that then leads you to is really having, I think, what Rusha said, of strong communication to all stakeholders for whatever project you're working on. I also think, though, what I thought was really valuable and what I would advise is to have a project champion for all of your projects. And I think that just goes with just in general, even when you're in the workforce now, but a project champion that's really kind of your go-to, particularly if in this case if you're a project manager or anything of that sort. So I really rely on kind of that champion over the project who acts as your own kind of pseudo mentor in that case as well. And of course, anything else, I always brought back to my mentors. So having strong communication within your team as well as your mentors, I think is really important.
Thank you, both of you, for touching on that question. Another question that we had was, what was the most important aspect of the fellowship that set you up for success in your career afterwards?
Could you repeat the question again? Sorry.
Yes, of course. It was, what was the most important aspect of the fellowship that set you up for success in your career afterwards?
So this is Taylor. I can touch on that a little bit, and I mentioned it in my brief discussion, was that I understood the information systems that we had well enough that that I was almost the professional in the facility of how to use these things. So I was able to have access to information that a lot of people didn't know how to get. Therefore, I was able to contribute to decisions and help make smarter decisions better than a lot of other people could. So mastering that and being able to be this kind of self-sufficient information gathering person is very useful in being able to turn out results quickly.
I would say this is Rich. I would say for me, there are a few things, but the one big thing that I recall our CEO saying, who's a former fellow as well at Barnes-Jewish, but great in terms of providing insight, was when you choose your area for the second year, and for us that makes more sense because we're a 2-year fellowship where you concentrate, but in other areas it might be projects that you take on if you have the flexibility to choose which projects. Try to get exposure or get into an area that you know there's a void or there's a potential need for more help. And by that I mean that you think strategically there could be an opportunity that you essentially make yourself an indispensable resource that they have no choice but to hire you on. So my role was, it's unique, it was created for me. I worked with my boss to develop the role. That's just how it worked out, but I know others at the institution, same thing. What they did was probably, I know a few of us mentioned this, is networking. As a fellow, you have access to a lot of individuals. You can kind of set up meet and greets with many people, network throughout the institution, because even if I didn't stay in cancer, I had the opportunity in several other areas. And that was because, I kept those lines of communication open. I met with people regularly, and they were able to see how I produced in terms of my work. So just always follow through on anything you say you're going to do, because people will remember when you do not follow through, even if it's as simple as like sending someone an email. And I think that goes a long way.
Thank you very much. And then we also invited graduate students to attend this webinar. And we have a question from a graduate student at this time. And it's surrounding interview questions. And how do you tackle the interview questions in terms of where you wanted to drive your career and future goals? And this is for applying to the fellowship.
So this is Ruch again. I'll say, so coming in, I worked before I went to graduate school only for a few years. I had no idea that I necessarily wanted to go into work in a hospital. In fact, I was actually about to go into consulting and almost went to management consulting until last minute I applied to the Chicago Fellowship. And I think it's perfectly okay to go into these interviews not knowing exactly what you want to do. That's kind of the purpose of a fellowship in some sense, to learn more about the opportunities that are available to you within healthcare administration or healthcare management. And so I think I would be more prepared in terms of the interview questions to understand more clearly why you're interested in the healthcare field and what you hope to gain from a fellowship in terms of direction, and what you hope to do specifically within that particular fellowship. So make sure your answers aren't generic, but you've done research on that fellowship, and you can kind of explain why this is a good track for you or next step in your career versus, I know I want to be a COO one day and that's why I'm doing the fellowship, or I want to be a CSO one day. I think it's in fact, many people that we've hired on, they're very frank around that. They don't know what they want to do, and that's what they hope to learn while being here. And honestly, even after the fellowship, you may not know what you want to do. And I think as long as you can speak to the other aspects, it should be okay.
So I'll just add to that, Ruch, and I believe that you are correct, but I also want to add that it is important to get an understanding of what you want to do and to do it quickly. I know that as I was interviewing here afterwards, later in the fellowship, I was chatting with the CEO, which I had an interview with, and he said, one of the reasons that we hired you on is because when I asked you the question, what do you want to be in the future? And I had a quick response and an answer, and I knew exactly what I wanted to be. So that was one of the reasons that we hired you on, because you had clear goals. And so Bruce is correct that you don't have to have exactly the position title that you want to be, but you do need to know that you need to have specific goals attainable of what you think you can do in the next 5 years, and be able to clearly articulate that.
Would anyone else like to touch on the interview process?
This is Emily. I know someone had asked specifically, since I had mentioned that I didn't know what I wanted to do. I knew I wanted to be in pediatric healthcare. I knew the population I wanted to serve, but I wasn't sure where I wanted to end up. And I know I would completely agree with everything that that Rusha said. You know, that's part of the value of the fellowship. I think particularly, so I went straight from undergrad to graduate school. I didn't have any work experience outside in between then. And then also I wanted project-based because I wanted to be able to explore kind of what I was interested in. And I think it's also important to, within a year or 2 years or however long a fellowship is, to really figure out too what you're not as interested in. So for me, I leveraged that question as more so a year to explore that, explore my interests lie, and to utilize the year of learning as an additional year of learning, not only an organization or skills, but where my interests are. I would also agree though of the comments of having you know, a clear path of a general, you know, future for where you're headed. I think you can use that though by saying, you know, for me, I said I wanted to be a leader and an advocate in pediatric healthcare. Who knows what healthcare is going to be like in 5 years, whether that's a CEO, COO, or whatnot. But to be a leader in healthcare with increasing, you know, responsibility. So that, at least that was my approach. But you know, I think the fellowship is, again, a year to really explore your interests. So,
thank you very much, Emily. At this time, I just wanted to mention that we currently have 71 fellowship sites and 35 graduate health management programs, part of NCAF. NCAF has been receiving a lot of interest from the field, and we definitely hope to continue growing. And we would also appreciate all of you spreading the word to other fellows at any non-NCAF sites about NCAF membership. Would be greatly appreciated. And also just thank you everyone for attending today's webinar, Lessons Learned from Recent Fellows. Thank you from the panelists. Everything was extremely helpful and very insightful. So thank you very much for your time. Also, please do not hesitate to contact me. My information is on the PowerPoint for you with any other questions, and you will receive a follow-up email within 24 to 48 hours with a link to review recording of today's webinar. So on behalf of NCAF and our presenters, thank you for joining us today, and have a great rest of your day.
Thank you, everyone.
Thank you.
Thanks.
Thank you. Have a nice day.